Hi, I'm Kortney. I am the patient voice on the Itch podcast, and I have only ever known life with food allergies.
Hi, I'm Dr. Payal Gupta, a board certified allergist immunologist, and I'm the second voice on the Itch podcast. And we're really looking forward to going through some food allergy myths with you and busting some of those myths.
Let's do it. So, Dr. G, you should delay introducing allergenic foods to prevent food allergies.
False. So actually early introduction around 4 to 6 months, whenever your baby's ready, is protective and not harmful. So studies like the LEAP trials showed that babies introduced to peanuts early had up to an 81% reduced risk of developing a peanut allergy. So waiting actually increases the risk. So introduce small amounts of the top 9 food allergens once your baby is ready to eat solids, and we want to continue those foods regularly.
Peanut allergy means allergy to all nuts.
That is not true. So peanuts are legumes. So they're not actually tree nuts. So being allergic to peanuts doesn't automatically mean a person is allergic to cashews, almonds, walnuts, pecans, all of those other things. So the tip is that each nut allergy must be tested separately by an allergist when there's a concern.
Great. Did you hear that? Peanut is a legume. That's like my special pub quiz fact. Just saying. Next myth. Mild allergic reactions aren't serious.
So false, even mild reactions like a few hives or lip swelling can be the beginning of a more serious reaction. So we always want to make sure that we're carrying our epinephrine auto injector, and we want to make sure that we're looking out for progressing allergy and using our epinephrine device early whenever we're concerned about having an allergic reaction.
Food allergies are outgrown by all kids.
That is false. Unfortunately, while many babies, children outgrow milk, eggs, soy, and wheat allergies by school age, peanut, tree nut, shellfish, and fish allergies are more likely to continue and persist on for the rest of their life. So tip is regular retesting guided by an allergist helps determine if tolerance is developing or not.
True or false, Dr. G? A negative test means you're not allergic.
So that's false. Skin prick tests and blood tests like IgE tests can sometimes miss an allergy or produce what we call a false positive. So the diagnosis when we make it is a combination of several things. So we combine history, testing, and we may actually do what we call an oral food challenge, which is where we give you the food supervised by a doctor and see what happens. So the tip really is to never rely only on a lab result without having a history to back up that lab result. That's why we don't do overall pan food allergy testing ever.
All right, Dr. G. If you have a food allergy, smelling or touching the food will cause anaphylaxis.
That is actually false. So severe reactions typically require ingestion. So touching or smelling a food may cause mild symptoms like a rash or maybe sneezing, but usually not full-blown anaphylaxis. That actually requires ingestion. But however, ingestion or swallowing the food, even in small trace amounts, can be very dangerous. So the tip is still be extremely cautious, especially with young kids who may rub their eyes or mouth after touching an allergen. But in general, smelling or touching of food just with your fingers isn't usually enough to cause a reaction.
This is a good one. Epinephrine is dangerous or should be a last resort.
That is super false. Epinephrine is the first line treatment for anaphylaxis. Delay in giving epinephrine increases the risk of severe outcomes. So the tip is use your epinephrine immediately if you're ever worried, okay? And epinephrine is a safe device, and we've done a whole episode on epinephrine. So watch that so that you are not worried and will use your epinephrine when you need it.
Great. Thank you so much, Dr. G, for helping myth bust with us. And I think that's a perfect way to end it is remember everyone, epi first, epi fast. Don't be afraid of epinephrine. And if you want to hear more about myths, we've got 2 episodes on it. So check out the Itch podcast wherever you listen.